Imagine wanting to start a family and you realize it isn't happening as you wanted. So every month the excitement builds up and then it turns into anxiety. And I've had so many friends go through this. There's people and everyone around them is saying, oh, relax. And then they look at Google and they're getting mixed messages. And it just becomes a minefield. It is so stressful. Now, here is something many couples don't want to hear, that 1 in 6 couples face fertility challenges according to the World Health Organization. Not because they waited too long or did something wrong, but because modern life places new pressures on our bodies that past generations never faced. I mean, one simple thing, take microplastics, for example, they're everywhere. Stress, poor sleep, hormonal imbalance, all these toxins we talked about, long work hours, processed food, all of these quietly influence fertility long before we're thinking about becoming parents. And in the middle of all this, couples are left wondering, why is this happening to us? Should we seek help? Is IVF our only opinion? What do we need to do? Who should we talk to? There are so many questions. Today, we're bringing clear, compassionate, and science-backed answers to a topic that's filled with emotion and confusion. This is Anshu Bahanda, and today on Wellness Curated, we're talking about fertility, IVF, and conception. What couples need to know. This is a practical, evidence-based look at how fertility really works, what IVF can and can't do, and how to make informed decisions on this journey. Welcome to the Wellness Algorithm, where we break down health topics in a way that's easy to understand and relevant to those navigating their reproductive wellness journey. In today's episode, we're focusing on fertility, IVF, and conception. It's an area filled with options, but also there's a lot of confusion and a lot of emotions here. Fertility isn't straightforward, conception doesn't always follow the predictable path, and IVF, while an incredible tool, is widely misunderstood and overwhelming. So the need for clarity has grown over the decades, and there's so many tools available. However, it's important to understand what makes sense to your individual journey. To help us explore this, I'm joined by Dr Nandita Palshetkar. She's one of India's leading IVF and fertility specialists with over 30 years of experience. And beyond her clinical work, Dr Palshetkar is also committed to education and research and is known for introducing innovative technologies in and around the field of reproductive health. Before we begin, a small request. Please subscribe to the podcast. It's free and it supports our mission to bring you meaningful, well-researched and science-backed conversations. And if today's episode resonates, share it with someone who might need it. They will bless you for a long time for this. Thank you. So, Dr. Nandita, I'm going to jump right in and ask you, what is IVF actually? So many of us are totally clueless about this.
I think this is a really good question because, there are a lot of couples who come in and they don't know the process. And when I tell them you require IVF, they're looking blank at me. In fact,
Right.
let me tell you one thing. One patient actually asked me, that's a test tube baby, right? So I said, yeah. They said, but how will you put us into the test tube?
Oh,
so
God.
it begins with all kinds of answers, but let me explain to you. IVF is nothing but creation of the baby outside your body. Normally in the body, the egg is released by the ovary. It finds its way into the fallopian tube, and then when you have intercourse, the sperms are deposited in the vagina, and the
Mm-hmm.
sperm swim up through the mouth of the uterus into the uterine cavity and into the tubes. And this is
Right.
where the egg and the sperm actually meet and fertilize. And the baby is actually formed in the fallopian tube. And then from the tube, it comes to the uterus where it grows for 9 months. So this is the natural process. So in an IVF process, what we do is we take the eggs out of the body,
Mm-hmm.
the sperms from the husband, and fertilize them in a dish, which actually mimic the fallopian tube. The fluid, the pH, the temperature is all like that maintained. And then 3 days later, we actually see this baby which is formed and gently pick it up and transfer it into the uterus, where it normally grows for 9 months. So, creation of that baby
Mm-hmm.
outside the body in a laboratory, in a dish, is actually IVF.
So tell me, Dr. Nandita, from all the couples you've seen, from all the experience you've had, when would you advise a couple to see a fertility specialist? When would you say, don't wait anymore, now you go?
I think indications are changing, but as we say in our science world, if you've had unprotected sex for 1 year and you haven't conceived, you definitely should see the doctor. Secondly, if you're more than 35 years old, don't wait for 1 year, wait for 6 months, otherwise, go see the doctor. If you're older than 40 years, I would say don't wait. You should go immediately so that you get the basic test done. It's
Right,
important because
right,
there is a problem, it can be treated right away and you don't waste time. But there is also another indication which is there, which is, preventive health. Preventive health is such a big thing now. We need to, look at preventive health and incorporate it in our lifestyle. So I tell girls that supposing you're unmarried or you've not found a partner, or you're busy with your career, you don't want to have a baby yet, you're mad, but you don't want to have a baby yet. I think it's important to test your fertility in your late 20s. And,
right.
in the morning, I had a patient who was 28 years old with the ovary of 45 years old. So
Wow.
this kind of accelerated aging is being seen in nearly one third of my patients in my OPD. And that's why I feel that, you can do preventive, you can do the tests, which is known as serum AMH, to determine the
Serum
quantity and
AMH. Serum AMH? What did
serum
you?
AMH. It's anti-Mullerian
Okay,
hormone. It's a blood test.
okay, okay.
And a sonography, and that will really give you an idea. So you can also use the newer technologies like egg freezing, embryo freezing to preserve your fertility. So even if there is aging, you can actually have a baby when you're 40 with the eggs that you frozen when you were in your early late 20s or early 30s. So
Right.
it is something that one should be aware of, and I'm so glad you asked this question.
And I'm so glad you mentioned egg freezing because I can't tell you how many young people today are confused about what it involves. So, if you can quickly talk to us about egg freezing, and I would love to do another episode with you just on that. But for the moment, just give us a brief idea of what does it involve.
I'll be very quick. It involves 8 to 10 days of medications where we, instead of making one egg, the body usually makes only one egg. So we try and make 10 to 15 eggs. Then we watch the growth of these eggs during your menstrual cycle with the help of ultrasound or USG. And then once the eggs are, say, about 2 centimeters or 18 millimeters, we give a kind of a trigger. Trigger is another injection which actually matures the eggs. And then we go in with a needle and just remove the eggs out of the body. You know how we remove blood tests?
Hmm.
Similar way, needle just reaches from your vagina to your ovary. And it's a 15-20 minutes procedure. You're not awake. You do not feel any pain. And in 3 to 4 hours, you can go home. And that's it. That's the process of egg freezing. Because once the eggs are got in the IVF lab, we do a process and we freeze these eggs. And do you know something? What is the shelf life? As long as I maintain the temperature of minus 196 degrees, I can keep it
Wow.
long enough.
Wow. Okay. And tell me, a lot of girls are worried that egg freezing will involve a lot of hormones and hormone injections. Is that right?
See, hormone injections are involved because you need hormones to prepare the your ovary to produce more eggs. So, yes, but remember that this hormone injection actually is out of your body within 24 hours. And
Okay.
IVF has been there for decades, I think more than 5 decades. And these injections have been used, and there is
Hmm.
enough studies being done to see that they've not had any effect on the women who have been subjected to it. So it's a very, very safe treatment.
Okay. And now I want to talk to you about age. As we know, scientifically as well as experientially, as you grow older, fertility goes down. So, can we talk a little bit about age impacting fertility for both men as well as for women?
Yeah, I think very important question. Age is very, very important. And in fact, there is a lot of research now going on anti-aging, how to halt your biological clock, etc. But if you look at the Indian ethnicity, we age 7 years earlier than the Caucasians. I mean, it's really sad, but
Wow.
true. And
Right.
it could be a genetic cause, it could be because of pollution, etc. Because the study actually studied Indians in India to foreigners abroad. So we don't know whether the AQI is affecting us or whatever it is.
Right.
But yes, age, I always am a little worried about announcing this, but have your first baby by the time you're 27, 28. That,
Wow.
yes, that would be the ideal age. But of course, anything under 35 is good enough. And if you can't have the baby, at least freeze your eggs, freeze your embryos as early as possible. Also, as you age, the chance of having a mentally retarded child also increases. So I think you need to take these things into account. And after the age of 44, it's 1 in 100 babies
Wow.
which are mentally retarded. With the man, fortunately or unfortunately, aging doesn't affect them till they turn 50. After
Right.
50, there is a slight increase in autism, in some other problems, but it's very, very low. The chance of having it is very, very low. So I think men also, the earlier uh, they have a child, it's always better.
Okay. And you talked about a fertility test for girls called Serum AMH and a sonography. What would you recommend? Any other test that you would recommend that people do beforehand, men or women?
I think men a semen analysis, simple test of the semen with with a semen which is probably 2 to 3 days old, not 15 days. You've not masturbated or you're not had sex and you give your test. No, you have to masturbate and throw the sample off, and then 2 days later give the sample for testing, because sperm deteriorates when it's in your body for a long time. So to actually know what it is, so when we tell people who are having wanting a baby that they should have sex alternate day, because then the sperm is also refreshed, rejuvenated, and it's much better, it's stronger, the mobility is good.
Okay. And then tell me about lifestyle issues, things like sleep, smoking, stress. You talked about microplastics, alcohol. How do these affect fertility?
Fertility is not only science, like medicine. I think there's a lot of science which involves holistically. If you look at it, I think the environment today, the environment is playing a big, big part. Okay, the environment pollutants. We have pesticides in our food. I mean, how much ever you wash them, sometimes you cannot get rid of them. Those pesticides, microplastics. So I think these changes need to be done. Then the lifestyle also, sleep early, exercise. We become couch potatoes. So exercise, sleeping early, eating good, healthy food. You know, I believe supplements should be taken because sometimes the food doesn't give enough of the body's requirements. And one thing that is really, really important is also mental health. You know, Stress of any kind or anything actually disturbs your whole hormonal axis. The brain controls the ovary. So this axis, it's known as the HPA axis, and that gets altered because of stress. And I think it does affect subtly. It does not cause infertility, but I believe that if you are in your best frame of mind, mentally happy, in a good, positive environment, the success rates of it are also better. So I think, I always say there are four pillars to our medicine in IVF. One is nutrition, one is sleep, one is exercise, and one is mental health. I think these are very important. The ovarian reserve testing for a girl is very, very important. So it's a
Okay.
simple blood test called Serum AMH, which can be done
Yes.
any time of the cycle. You don't have to be on second day of the period or third day of the period. And a ultrasound. Ultrasound looks at the ovary and does a antral follicle count. So they actually count the small number of eggs that are there in the ovary, and that gives us an idea how good or how bad the girl's reserve is. So I think this is a test. And of course, other hormones like thyroid, prolactin are important. And I feel anemia is very prevalent in women. So a
Yes.
CT would really help us. Nowadays, I'm seeing a lot of, fatty liver because of obesity. The girls have a fatty liver. People don't, in the report it's written fatty liver, people just ignore it. But I think that so contributes, and it's important to check your, liver enzymes to see if they're elevated so that you take steps to, treat it. And obesity is a big problem, which is a hurdle also.
So tell me now, can you explain the process of going through IVF in simple everyday terms so that, someone who's intimidated by it relaxes a little bit?
Thank you. I think that is very important because today IVF has become patient friendly. So, what happens if a girl walks into my clinic? I explain to her the process, and let me take you through the steps that she goes through. So, first, a blood test and a sonography is done to assess her. Once we have a look at the reports and decide that she's going for IVF, we stabilize her thyroid, we stabilize her vitamin D, B12, and if there is any anemia, we correct it. I think that all these things are taken care of. And then she enters the process of IVF. So the process of IVF usually starts on second day of a period. So from second day to 10th day of a period, first day is the day you start bleeding. That is day one.
Right,
So day
right.
2 to day 10, usually she takes hormonal injections and they're taken every day. Now, how do we know that the eggs are growing? Because sometimes we need to titrate the doses, give a higher dose, give a lower dose. So we do sonography on day 2, then day 6, day 8, and usually day 10 is the final day. And that day we do sonographies every maybe four sonographies in a cycle, and then
Right,
we give injection to a trigger to rupture the egg or to mature the
right,
egg. Then
right.
before this egg matures, so once I give a trigger between 34 to 36 hours after the trigger, I go in and retrieve all these eggs. Once I have retrieved all these eggs are then taken into the laboratory. And as I said before, the girl then wakes up on the table. Usually, my patient, how many eggs did I get? you know, then they go to their rooms, and after a couple of hours, they drink, eat, and then they go home in 2 to 3 hours. So it's a OPD process, short general anesthesia, and then the work begins in the laboratory. So that is the process. Now, once the babies are ready, we call the patient back after 3 days, and gently, this time there's no anesthesia. The patient is just taken in like that into the IVF laboratory, and we load one or two babies on a thin tubing, which is a catheter. Then we just inject those embryos into that cavity. It's a process without anesthesia, very painless, and it's very easy. I must have done thousands of embryo transfers.
Wow, wow.
The feeling of the doctor. I think
So,
that is the most important step.
what a fantastic job you have. I think I saw this film, which was about the first IVF baby. And that's when when you
I,
see that, you realize the significance of this. But tell me, what are
yeah,
the chances of success given today's technology?
that's great. When I began 35 years ago, the success rate was 10-15%.
Hmm.
Today, 35 years down the line, the success rate is 50 to 60%. So
Amazing.
the younger the girl is, the better the success rate. If you're 40 plus, your success rate drops to below 40%. So I think that's what I meant, that assess your fertility earlier, freeze your fertility if you feel you don't want to have a baby so soon. In fact, you won't believe it. The other day, I had one of my friend's daughters come to me. She says, Nandita, auntie, I don't want to have a child. I said, oh,
Mm.
okay.
Yeah.
So she said, but you know what? In case I feel like it when I'm older, I can't do it. So I'm going to freeze my embryos because Nandita auntie is sitting in my backyard and I
Yeah.
didn't use. So she came and she froze her embryos. Took up,
Very wise.
on the same
Very
page.
wise. Yeah.
They froze their embryos, and she said, I'm keeping my doors open. In case I want to have a child, I will have it later on. If I don't want to, that's fine. So, yeah, there are different thought processes with this generation. I do
Yes.
feel there's a
Yes.
generation gap.
Yeah,
Me
no,
and
absolutely. But tell me, in terms of IVF treatment, um, you know, it's people say it's very emotionally and physically demanding. So, what should couples realistically expect during the process?
You know what the problem is? Infertility is like a social stigma. It's not only a
Hmm.
disease. You understand?
Hmm.
It's a kind
Yes,
of
yes.
a social pressure that we put on ourselves. And even if, nowadays I think mother in laws, father in laws are pretty liberal, but there is unspoken pressure on the girl. The girl is with her friends.
Absolutely. I wanted to ask you about that.
The girl is with her friends, the friends have children, and all they're discussing is nannies, timetables, this class, that class, music, sports, and this girl feels left out of it. You
Hmm.
understand? And nobody does it on purpose. It just happens. It's a natural thing that really happens. So I think there's a lot of unspoken pressure. And of course, a lot of families still do have they are pressurized that, okay, it's high time you have a child, blah, 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 etc. So I think it's a very, very emotional journey. And if this girl has support, especially from the husband, we are in it together. The husband comes for everything, he's with it, he's supportive to her. I think it is amazing. And secondly, even the family. In India, of course, we have, the mother in law, the father in law, the sister in law coming, the brother in law bringing the. I think the village which is behind this couple, I think it makes a lot of difference. Because remember one thing, when you have one child which is born, a family is created. Father,
Yeah.
mother, but uncle, aunts,
Mm.
grandparents, oh, fufa, fui, I don't know, you
I know.
understand.
Everyone. Yeah, absolutely. Absolutely. But I want to ask you about something slightly sensitive now.
Yeah.
You talked about the pressure on the woman, but from what I've seen with friends, and I also have seen this in different stratas of society, and not just Indians, I've seen this globally. The assumption is there that the issue is with the woman. How common is male infertility?
Ah, this is, बोलते हैं ना दुखती रप्पे, whatever I created in the. But yeah, I think that things have really changed. Do you know 30% of the infertility is because of the man?
Hmm.
Percent is because of the woman, and
Right,
30% have a little bit of a man responsible, a little bit of both the people are responsible. And
right.
10% actually don't find any cause why the couple is infertile. So actually the severe male infertility is 30% plus, I would say another 30% mild infertility, which actually contributes. So 50-50. In short, the man and the woman are responsible for the infertility. Initially when I started practice, the girl would come alone. She
Mm.
would, oh, my husband doesn't want to do the test, but I want to
Yeah.
test my and all. But today it's different. The boy comes. He will test his semen. The girl is working, she's busy in the office. He will bring all the reports and, find out what's wrong. So I think that is a change which I'm seeing in my practice. But yes, probably that is maybe one third of my patients. Two thirds,
Right.
yes. Uh, and also, the men feel inadequate, that there's
Yes,
something
yes.
inadequate in them. So I think it's a very tricky situation. We have to handle it very carefully. We have to be very empathetic. But I think I think it's the same, Anshu, for man and woman. You have to be empathetic to the girl as well as the man. I think both of them need their tender loving care.
Yeah,
And
yeah,
today,
absolutely.
children are, I would say, mollycoddled, but my
Mm.
parents would say that about me, and I say that about the next generation. But yeah, we do try and protect them against the world, and so they're not ready. They want, they get everything very quickly. They want results quickly,
Yeah,
so the
yeah.
patience level is much much lower. So
Yeah, it's
counseling.
the instant gratification generation, as we call them,
Yeah,
right?
that's the word. That's the word.
Everything, there's Uber's
Everything.
on tap and everything's on tap, right? So,
The 10
anyway,
minutes to delivery, I think. That's crazy.
but I want to ask you, while we're on the topic of male fertility, I want to ask you how important are sperm quality and testing? And what do you think should men do to understand or improve their fertility at an early stage?
I think what is important is first to diagnose the problems, to do the test. If the quality is poor, then you have to look internally. Are
Mhm.
you
And what are
smoking?
the tests?
Yeah. Semen analysis, simple,
Okay.
straightforward semen analysis. There are not many tests that we do. Okay,
Okay.
the simple thing is to look into yourself. Do you smoke? Do you drink alcohol? Do you take drugs? Do you do a lot of steam and sauna? Because that is also not very
Ah,
good for testes. And do you
okay.
keep laptops on your lap near your testicles? And it creates heat, so that's not good. Even wearing tight underwears, working near furnaces, I
Right.
sometimes feel even riding the motorcycle for very long can probably affect it because that
Interesting.
part gets heated. Though the latest motorcycles are much better and they have the technology, but all these things do matter where a male is concerned. And I think these are things one should look at. And of course, the pollution is a big contribute also these days. So we have to keep these things in mind. Eating anti-inflammatory foods, I think it's really, really important.
So
Your
tell
diet.
me, Dr. Nandita, uh, there's so much that's happening in the world of science, right? Are there any scientific breakthroughs for fertility? How do you see this shaping up? How do you see fertility treatments shaping up with the new technologies coming in?
Oh my God, we have opened a Pandora's box. You
Right.
know, just last 2 weeks ago, I read that
Hmm.
now we can manufacture eggs and sperms in the lab.
Right.
You don't need the woman, you don't need the man. You take a skin cell, the skin.
Wow. Wow.
It has a
Okay.
nucleus, it has the DNA, and that skin cell is converted into an egg.
Wow.
And you probably, now this problem which I'm saying, the eggs are less, this, that, will not arise because you just take the skin, produce 20 eggs for a child. But yeah, a litter of mice has been born. Of course,
Oh my goodness.
this technology has to be confirmed that it is safe. See, you may very well create the egg, but what is the longevity of the egg? What are the after effects? Will this child have cancer? Will this child have other problems? Will the DNA mutate? So, all those things definitely need to be studied. And so far, we don't have answers. But yes, the technology is here. Then there's another technology called CRISPR. And there are these two ladies, Emmanuel and Dudna, who actually won the Nobel Prize for it in, I think, 2021 or 2022, just post COVID. And you know what the technology is? It's gene editing. So
Right.
suppose I have a family, I belong to a family where thalassemia is a trait. Now, if I marry somebody who also has a thalassemia trait, the child can suffer from thalassemia. And
Right.
thalassemia is bad because they need blood transfusions, and
Mm-hmm.
usually life is hardly, 20, 25, 30. If we have a pre-implantation diagnosis by which we can identify, okay, this embryo is got only a trait. This embryo is free of any trait or any disease. And
Wow.
it's got a disease. Now, this new technology called CRISPR. And yeah, two women have won the Nobel Prize for this technology, CRISPR. Emmanuel and Judna, I think in 21, 22, I don't remember the year. But this is actually gene editing. When you're doing your time lapse photography, when you're doing combining videos, you splice it, okay, I want this, and then you join it. So actually, you can edit a baby. The baby has
Wow.
a gene which is not good, which is a disease giving gene like thalassemia. This virus, which is loaded with the DNA scissors, it's called, and it's
My
infected
goodness.
baby. It goes and cuts that DNA, that faulty DNA, and inserts the normal DNA. And this baby becomes disease free. The embryo becomes disease free. So I think this gene editing, right now, we just throw away these embryos, which are diseased. But 10 years down the line, we will be cleaning up this baby, and baby will be
Wow.
fine. And we're using
Wow.
for a lot of cancers and different kinds of things where they can eliminate. In fact, let me tell you one thing. In China, one set of twins was born where Dr. He is the one who tried this CRISPR in
Right.
in humans, and these babies were born. They would not ever get HIV, or I think it was cholera.
Mm-hmm. Wow. Okay.
So, but of course, he was jailed because we don't know the effect of this in humans yet. We don't know what would be the subsequent, maybe 10 years down the line, they develop cancer, or they develop something else, or they die early. Like, Dolly, right, who was cloned. She was
The the
born,
the sheep, Dolly the sheep.
Dolly the sheep, yeah. She was born at her mother's age. Her cells were not of a newborn, they were of old age. So that is a new thing, the Yamanaka factor, which now has shown that how you can bring the cells back to the, to
So,
the stage
doc,
zero.
Dr. Nandita, quickly tell us about Dolly before I go on to the last question.
Dolly was the sheep which was cloned. So you normally when you want a baby, you have the egg and the sperm, right? So the DNA comes mixed from you and your husband. But Dolly's DNA came only from her mother because her skin cell was taken and that was converted into an embryo. So the DNA is the skin. Now the DNA is taken from a 40-year-old. It'll be a 40-year-old DNA.
Wow.
In the womb, what happens is there's resetting of the clock, and the DNA actually goes to zero. And then, do you know when aging starts? Can you tell me? Come on, Anj. Tell me when aging starts in a person.
As soon as you're born, aging starts from conception.
Yes, but in the womb.
Yeah.
It starts in the womb.
Womb
But the
from
curve
conception.
of
Yeah.
aging depends on all the epigenetics, the external factors, everything. So I think that is important, and that is something you need to remember. So Dolly was conceived from her mother's DNA.
Okay, Dr. Nandita, my last question to you before we go on to the rapid fire round is for anyone planning to conceive, what are the key things that they should keep in mind? Stuff that you would advise them as a doctor to bear in mind. And what are the things that can help them as well?
I think coming early is very, very important. Age of the woman is really important. Second is lifestyle. I think smoking, alcohol, drugs is a no-no. Exercise is very, very important. Nutrition, there is a fertility diet. which is high protein diet, a Mediterranean diet, which really helps. And today, I mean, if people don't have it, we use a lot of supplements to help patients. And of course, mental health. Mental health is very important. And today we have technology. That is my fifth pillar. And this is the technology which is there in the lab. We have artificial intelligence, we have time lapse photography. So it all helps me. For men, we have so many different techniques of choosing the sperm, microfluidics, magnetic activated sperms, then there's IMC. I know it's all sounding very fantastic to you, but these are all the technologies that we use in the lab to give a child. So I think going to a high end laboratory also matters. And all the other four pillars which I mentioned definitely together will help. Obesity is also very important from fertility point of view, and it contributes to bad quality eggs, to the bad endometrium, to the hormonal disruption. So I think we really need to look at obesity also.
I want to quickly go on to a rapid fire round. I'm going to ask you the most Googled questions about fertility, IVF, and conception, and you can clear it up for us. So, the first one: does stress really reduce fertility?
Not really, but no,
Okay.
no.
Now, this is something you touched on. Does tight clothing affect sperm?
Yes, so tight underwear is a no-no.
Okay. Is day 14 ovulation true for everyone?
No. If a girl has a 28-day cycle, she can ovulate between 12 to 14th day.
Okay. And are period tracking apps reliable?
Pretty much they are good, so there's no harm in using them.
Does traveling during IVF harm the cycle?
Not at all. Not at all. I tell my girls don't sleep in bed.
Oh,
How
thank
they
you.
for 2 days and then they go back to work.
Thank you, Dr. Nandita. We've had such an informative and groundbreaking conversation today to remind us that fertility isn't just a medical journey, it's a personal one. And thank you for helping us understand how conception works, knowing where to seek help, and learning what IVF can and cannot do, giving people clarity on this particular topic, which, you know, people are hesitant about, but it's such an important topic in their lives. And the right guidance can really, really help people, but it can also be overwhelming if you don't have the right answers. So, if someone in this episode helped you understand your own fertility journey a little better, or offered clarity on IVF and conception, please share it with people who might need this information. And don't forget to subscribe. It's free and it helps us continue creating a community that learns, supports, and grows together. I'm Anshu Bahanda. Take care of yourself, be patient with your process, and trust that informed choices can make a real difference in your well being. Thank you.